Let's talk about a hip drop. So hip drop is one of the OP mechanics that leads to the overworking of your adductors and eventually the development of OP. Ideally, when you're walking, what you want to have is a nice level pelvis. And so what I mean by that is, as you take a step, so you lift one leg forward, one leg's coming in the air and another leg is staying on the ground. And what you should be happening is this pelvis should remain relatively level. It shouldn't twist from side to side. In a healthy pelvis, this is what's happening. In someone who has OP or a hip drop, this isn't happening. Each time you lift up your leg off the ground, you're going to tip to that side and you're going to end up with a twist in your pelvis like this, what's colloquially termed as a hip drop. Now, this creates a bunch of issues for the body. The first and most obvious one is your spine is connected right here and goes up. So every time you tip your pelvis, you're twisting your spine with that. And obviously, if you're snaking your spine violently with each step, your spine's not going to appreciate that, and you're probably going to get some lower back pain and some lower back dysfunction. Specifically for OP though, we're interested about what's happening in this area here around the pubic symphysis and around the adductor attachments. So just for some quick revision, remember that our adductors, they attach right near the pubic bone and they attach all the way around the rim here, and they also attach down to some of these areas through here as well. So this whole section of bone through here has really strong attachments from the adductors. That's where they start. And if you're going to start shifting your pelvis really violently when you're moving, you're going to really start to yank at these adductors. Now with a hip drop, what we're actually interested in is not so much how far your hips drop, but more how quickly they drop. It's the speed that creates the whiplash that's so damaging to your adductors and your pubic bone. So when you sort of walk and your hips drop really violently, you are essentially yanking at these adductors really violently. And of course, they're not going to appreciate that. Now, if you have OP, what's going to happen is those same adductors, they're going to feel that hip drop and they're going to try and contract as hard as they can to prevent that from happening. They're going to try and pull and level your pelvis for you to prevent your hip from dropping and to prevent you from hurting your lower spine. And of course, if you've already got OP, this is going to really wear them down. They're going to get fatigued because they're having to do it with every step that you take when you're walking. And it's going to play a big role in contributing to the overworking of your adductors, which we already know from previous videos leads and causes osteitis pubis. So you're probably going to want to know, how do I address and fix a hip drop so that I can stop overworking my adductors? And you'll remember in another video we spoke about how you can't isolate an issue like a hip drop and try and strengthen one single muscle to correct it and still fix your OP, because the issues of your OP mechanics, your hip drop, your anterior pelvic tilt, your overpronation, they are all interconnected. And if you want to correct your OP, you need to fix all these issues at once, at the same time, as opposed to trying to isolate them individually.